Hello, hello. It's Tuesday. It's not noon. It's 5. So happy to see you. We're coming to you a little bit late today because we are talking to Dr. Monique, and she is a doctor, so she's really busy during the day and doesn't often have time for a break in the middle of it to do IG Lives, but I really am excited to talk with her and share her story and talk a little bit about her philosophy. Hello, as a doctor. And so we're coming to you in the evening, and hopefully she'll be here any second. I just connected with her about a month ago. I'm not sure how many of you already follow her. She's completely awesome. We're talking about Dr. Mo. I met her through the fantastic woman named Liz, who we interviewed a few weeks ago. Liz and Marty came on to talk on IG Live with me about Mamagen Bio, which is a new diagnostic company, and they have an awesome new way that will be commercialized, I think sometime in the next year or two, that helps diagnose breast cancer in young women. And I will put a link to them in the comments here. But Liz introduced me to Dr. Mo. We had a FaceTime and immediately bonded. She's so awesome. Hello. And I really just, everything she said about being a doctor and how she treats her patients and the follow-up that she does felt really aligned with the mission of Brilliantly and trying to help support women really feel well in their survivorship and their previvorship. And she addresses all of these. Hello, I'm singing your praises and you're here. Let me invite you to join. Dr. Mo, let's see if this works. I've had a hilarious amount of Instagram trouble lately, and I every week cross my fingers that it's going to work. Let's see. Hello, how are you?
Magical. Oh my goodness.
We're here.
We are here.
I was just doing a quick introduction, and I will let you do your own introduction, but saying that we met through Liz, who's so awesome, and reminded people that we did an IG Live with Liz and Marty from Mamagen, and that you and I had like a quick Zoom call, and I was like, I love you, you're so great. And so I'm really excited to talk to you here. And why don't we start by you doing your own little bio, because I'm sure I didn't do you justice.
Oh, no, I'm sure you do fine. Hello, everybody who's watching. I'm still learning Instagram. This is probably, I bet this is my second or third live ever, and it's awesome. I'm Monique Gary. I am a breast surgical oncologist. So I'm a breast cancer surgeon in Sellersville, Pennsylvania. And I'm also the medical director of that program, so the whole cancer program. I am an advocate. I am a warrior. I am a person who is deeply, deeply invested in, one, curing breast cancer, right? Like, we talk a lot about, survivorship and a lot about balance and a lot about, surgeries and treatments, but I think we got to focus more on the cure. I am active in many advocacy circles and medical advisor to some phenomenal organizations, including Touch the Black Breast Cancer Alliance, the Chrysalis Initiative. I serve as an advisor on the cancer support community of Greater Philadelphia, Living Beyond Breast Cancer, and many others. So I do what I can, where I can. And here I am. I'm so excited to talk to you today. It's so good to see you.
Yeah, you too. I think we talked about so many things in our little intro call. And the thing that you said to me that just made me like you so much, in addition to all of the great work, like you just rattled off the names of every amazing organization and working to cure cancer, which is really the goal here, right? But the thing that you said to me is that when you see your patients like 6 months, a year after surgery, you said that you ask them, like, are you getting laid? And I was like, yes, thank you for asking that question.
Yeah. And it's so important because, we're surgeons. We slap a lot of lipstick on a pig, let's be honest. And what I mean by that is we do some amazing work to hide scars, to do great reconstruction, tummy tucks, nipple sparing, all the things. And we're getting better at it. We're helping to be able to do things like restore sensation, because I think no one tells you when you're contemplating and going through this process that, one, your life does change, and everybody hates that term, the new normal, but guess what? It really is to some degree, because at every stage of treatment, there's sexual dysfunction that needs to be talked about. There are intimacy issues, there's self-esteem issues, there's confidence, there's, sleeplessness, there's anxiety, there's all these things that cancer robs us of. Whether you have cancer, whether you're a pre-vivor, whether you're a family member, a loved one, a caregiver, right? Like it's robbing everybody of something. And so my job is to try to really, beyond doing surgery, tip the scales back a little bit in terms of balance and favor for people, so we can have healthier lives and live a more fulfilled life, and not the one that just says, well, thank God I'm alive.
Yeah. And I think that's what really hit me the most about our conversation was I think a lot of surgeons do an amazing, beautiful job in a way that, we look down and think like, wow, that's less scary than what I Googled when I found out I needed to do this. But that doesn't mean that you immediately feel at home in an altered body, or that you understand what it's going to be like to be numb, completely numb for 6 months, or to be in pain, or and what that does to, like, just even simply getting dressed in the morning, and how you think about yourself and your sexual health. And I loved so much that you address the whole person. I think there's more and more, to your point, surgeons doing that, but it wasn't the norm. And we're just now really giving women permission to talk about these things that impact them at every minute of every day. It's
yeah. Oh, sure. It's true, because what I realized when I started my practice, I was so proud of this surgical work. And I asked that patient, a patient of mine, 6 months, a year later, I said, okay, how are things going? How you doing? She said, oh, I'm doing pretty good. And I said, are you getting laid? Waterworks, or how do you like things here? And they're having sex with their clothes still on, even though their scars are hidden, and their breasts are perkier than they've ever been, and all these things. And I'm like, wait a minute, where's the disconnect here? And the disconnect is, it's not in them, it's in us. It's in how we view, what we do for cancer patients, and for previvors, and for metathrivers. And, like, there's so much more, I think, to the picture, that we can do beyond just the pink, right? Beyond just the warrior and the fight, but there's like life in between. There's kids, there's caregivers, there's elders, there's, all decisions that need to be made. There's COVID, there's all these things. And so I think focusing on the whole person really benefits the patient. It makes my practice more well-rounded. It makes people feel connected in their bodies, in their minds, in their spirits. And really, that's where I think we have to get to, right? Wellness is not about cure. Because there are people who are well and thriving, living with metastatic breast cancer every day, right?
Right.
It's about, how do we feel in our bodies? How are we managing our life's purpose? How are we interacting and engaging with our kids and with our lovers and with ourselves? And can we be better masters of those things while we're here, for as long as we're here?
Yeah, so well said. I think, to your point, a whole family, a whole community of people gets cancer when one person has cancer or has surgery or does an intervention. And that means that everybody's, it's like a big splash in someone's pond, but there's all those ripple effects that affect their little community. And it felt, or at least my experience was, it seemed really difficult to ask those kinds of questions or to bring that up because it felt selfish. I felt like, I made this choice to have preventative surgery. I felt so grateful that my story was not going to be, hopefully, the story that my mother had. And then I thought, okay, well, I have all these issues, but I should shut up and deal with it because I picked this. And I was so unhappy. My first set of implants, like, completely drifted apart. And the right one was, like, almost in my armpit. And I was one of those people not even looking in the mirror. Like, I would get out of the shower and I would have my towel right there to, like, wrap myself up. And it took a really long time to say, I'm actually not happy. And to realize that that was okay. Because yes, I can be grateful, but I can also be a little vain. And those two things can live simultaneously. And there's no shame in talking to your doctor or asking, why did this happen? Is there something that we can do? But I think patients don't always feel empowered to ask.
It's true. Yeah, and I don't think we always give patients the permission to do so. Not that they need that permission, but I think you kind of do for that reason, right? You feel happy to be alive, and you feel grateful for, for so many things. But could you be happier? Could you be more satisfied? Are you getting laid? Is it good? Can it be better? Like, it's okay to I'm still there. Sorry, I got some battery issues.
Oh, no problem.
But I think it's important. And one of the things that I love about you and what you've done is that, great, you've got implants, but could they be warmer? Could they be better? Could we be happier in our bodies? Could we have better fitting bras, and could we have more comfort? Like it's a huge thing. And I think it's something that we really need to applaud. I applaud it.
Yeah, well, thank you so much. I think for me, when I would describe to like my close friends what it felt like to have implants, it was all words that I would never use to describe myself, right? Like they were cold, they were hard, they felt foreign, they were uncomfortable. Like all of those things just felt like the antithesis of who I feel like I am as a person.
Yep.
And I really think that there's something like essential and really human about just feeling warm here and feeling like you can give someone a hug where you're not putting your cold chest on them. So I'm really excited about Brilliant Warm, but I also recognize that it's part of a much larger trend change in women's health and breast cancer, in doctor-patient relationships. And my sincere hope is that in 10, 20 years, women have completely different options. Women who find out about their hereditary risk, women who are diagnosed with cancer, that they're faced with really very different and much better choices about what their life is going to look like and what their body's going to look like and feel like.
Yeah, and I think we're on the horizon. We're on to something, right? Because we are now in the era of really being able to detect from pre-malignant state, right? We're starting to figure out things like liquid biopsies and atypia, and whose atypia could go on to progress to breast cancer, and what are some of the growth factors. And I envision, and I would love to see breast cancer research be a lot more defined like colon cancer research, in that we know the progression of gene changes that go from a polyp into a colon cancer, and we can identify every step what's going to happen next, what are the changes, and we can even start to intervene in those changes or take that polyp out so it never becomes a colon cancer. And breast cancer research still has a ways to go, both in terms of the science, because it is a lot more complicated than that explanation, but also in terms of the diversity and
Right.
making sure that all of our voices are represented, all of our anatomy, all of our genes, everything that that there's parity and that there's balance. And so that part of it is a huge goal and a mission of mine as well, is to make sure that there is equity in even how we are treating where we are today, right?
Yeah.
Before we get to tomorrow, there's some people who aren't getting all they should get today. And so that's why I partner with some of these amazing organizations.
Yeah, I think I'm so glad you brought all of that up. I think there's a huge, the racial inequities in healthcare we could talk about for like the next 20 years. And I think there's some organizations really trying hard to fix that, especially around research. For people who don't know, I don't know, Dr. Mo, if you know about the wisdom study. It's,
Yeah, you go ahead, talk about it. I love it.
The wisdom study, for any of you watching now or later, if you are over 40 and you have not been diagnosed with cancer and have breast tissue, you can enroll in the wisdom study. And they're really actively looking for women of color. They're trying to diversify the group of women that they're following. They're looking for 75,000 people to track over time, and that will help all of us. And I know that me and like my loved ones feel skeptical about someone knowing our health history, following us, using our data. But I think that we're in this, it's an opportunity actually to change the face of how we understand breast cancer and how it affects different communities. And we just have to start doing better for especially women of color. We don't have the history. They weren't included in studies in the past. Like, it's absolutely effing time to change that. And so we've posted about it a few times on the Brilliantly channel. I'll post about it again since we're bringing it up now, with the link to join or to get more information, because I think, now is the time. There's a whole amazing bright future, but if we don't fix what's happening right now, we're not going to make any headway.
I love that you said that. And the wisdom study really seeks to how to personalize our breast cancer screening. And so for people who are thinking about and interested in wanting to understand better, that clinical trial process, right? That's a thing that you can do. It's something that's not a drug trial. You don't have to have cancer for it. You're not going to get the placebo, but it is an individualized, tailor-made prescriptive of how your breast should be screened. And that is what the Wisdom Study is. And the registry, that part of it, the tracking part of it, is all protected information. You should know. And so I'm the chair of the research board, the Institutional Review Board, or the IRB, at my institution. And any studies that we do, the data that gets collected gets de-identified. So nobody knows it's you anymore. You're assigned some random number that nobody knows. And then two, it gets protected and code encrypted and put in places where it's stored so that you don't have to worry that your data is being compromised. It's not like your passwords on your cell phone,
Right.
or when you go to the bank or you go to PayPal and you get that email a year later. Oh, by the way, sorry, all your passwords have been, exposed through a data hack. This is not that sort of thing. And so, we want to demystify researcher people, because research has got a bad name, but guess what? Research has got us here, right? Every single thing that we do, that we put in our mouths, that we taste, every product we use goes through a research process, right?
Right.
And so it makes sense that for cures, for advances, for treatments, for everything else, that there would be a process and a standard way of doing that to make sure that works, to figure out the dose, to make sure that it's safe. And that's what clinical trials do. And so when you explain it that way, it's like, oh, okay, I'm not the guinea pig. No, you're not the guinea pig.
Right.
This has been tested already. This has been tried. We've looked at these things. And when there are people like me, representation matters. When we're at the table, we're not on the menu.
Right.
And so therein is also the challenge, I think, is to make sure that we are always represented and at the table where research is being designed and where studies are being, contrived and being executed, so that we can help our patients to feel more confident about even participating in those studies. So that's the future for me. That's where I'm going. It's like, what kids can I talk to? Who can I mentor? How can we get young people into laboratories and into public health sectors and into these corporate spaces where these things are happening, so that they can be a part of that process too, because they need to see it and know that they are vital in those spaces.
Yeah, absolutely. And thank you for explaining that so clearly. I think, one of the most important things to remember with these kinds of studies like the Wisdom Study is you should be doing this screen anyway. And in some cases, they'll help you get it covered. I know there's this ongoing debate about if we should be doing breast exams, how often women should be getting mammograms, all of this, and they help you figure that out. And it's things that you should be doing anyway. And when you have the backing of researchers and an institution, you can feel more confident about taking care of yourself. So I think, anyone who watches this now or later, if you want information, you can obviously talk to me or Dr. Mo about any of these things or ways to get involved, because now's the time.
Yeah, you're absolutely right. And on the subject of breast exams, I know I wasn't ever taught by my mother or my grandmother or my aunts or anybody about how to do a breast exam and what things should feel like. And I probably wasn't even taught by my doctor. It wasn't until I decided to go into breast surgery that I realized that, oh, this is what this feels like, because someone actually walked me through and said, okay, this feels like this. This is what fibrocystic breast changes feel like. Here's a cyst. Here's a this. And so we don't do that with our patients, right? We don't do that in our families. And the reason they are saying that we should not do the breast exams, or what we call the clinical breast exams done by the docs, is because nobody knows what they're going to feel and everybody freaks out. And next thing you know, you're getting unnecessary imaging, unnecessary radiation, unnecessary biopsies.
Right.
Well, why not teach people better what to feel and how to check their own bodies, right?
Yeah.
Why is that not the thing?
We had like a heated conversation over here at my house about that with another woman whose mother died from metastatic breast cancer, whose doctors told her to never do her own breast exam, and a couple of male friends. Like, we were having this discussion. They were like, well, and it got kind of heated. And I said, the real problem is that no one talks to us about do it every day for a month and understand how they feel different during your cycle.
Ooh,
Talk
I love that.
Mm-hmm. Like, they change all the time. When you're young, when you're nursing, when you're pregnant, when you're menstruating, they feel different all the time, and you're going to feel stuff that's weird. And you should know, oh, that's weird on the third Tuesday of every month. That happens. And I think there is absolutely no shame in being the person who shows up at the doctor and is like, what is this?
Mm-hmm.
And I think
it's true. Yeah.
But yeah, we need to teach everyone how to take better care of their own body and not just trust that you're going to go in one time and somebody's going to feel it and give you a thumbs up and then you're good to go. Like, we are the only people who know what it's like to live in our bodies. And it's really important to understand what they should feel like.
Yeah. I tell my patients that all the time, like you know your body better than anybody. And your body is not betraying you. You've got to learn to listen to that body. You've got to know what it feels like to be you all the time. And moreover, you got to be my eyes and ears. You got to be my accountability partner, right? So I do these accountability packs. And if any of my patients are watching, I'm curious to know how it's going, because I don't think I hold up my end of the bargain very well. But we make these little pinky swears at the end of some of our appointments, where, okay, if you haven't been doing your breast exam, you're postmenopausal, so you're not going to get a menstrual cycle. What's your favorite number between 1 and 30? What do you mean? What do you mean? Oh, no, pick a number. Like, what's your favorite number? Well, the 8th. Okay, so every month on the 8th, that is your day. That's a day you're going to do your self-breast exam every month for the next 6 months, right? Once a month at least. Give me that. And I'll say, okay, so I'm going to see you later, but you're going to let me know every month on what day was that again? Oh, on the 8th. Okay, so on the 8th, you're going to do your breast exam. And if you feel something different, I'm going to hear from you on the 9th, right? And they say, yep, okay. And so then I say, so for my part, here's my accountability, because diet and exercise is a thing I want to work on. And my dry cleaning is hanging right now on my recumbent bike. So you're going to do your breast exam, and I'm going to move the dry cleaning off my bike, and I'm going to actually get on it. I might not do it every day. I probably won't. But can I at least do it 3 times a week? I'm aiming for it. When you see me in 6 months, ask me how it's going. Okay? And they're like, okay. And we do our little pinky swear, and there you have it, right? We're accountable to and for each other. But knowing your body is one of the best things, and pausing, taking that break, because women are busy, right? We're on the go. We're moving, we're taking care of everybody else, putting out fires left and right at work and churches and home, and, still trying to like get our groove back. But who's checking in? How are we checking in with ourselves? Mind, body, and spirit. So at least if we can do the body part of it, then maybe we could actually get to the mind part of it. Maybe we'll take 10 minutes after that breast exam and light a candle and do a little, little meditation, right? Maybe we can get up that next morning and do some stretching, and maybe we can meal plan and do those smoothies, and it trickles over.
Yeah, I love that you brought up accountability, and I think it's such a fun thing to do with your patients, because it makes them, myself included, we think you're gods. It's really hard to remember that you're just a person.
Yep.
You know so much about things that we don't know anything about. And when you level with us and say, guess what? I'm not taking that great care of myself in this way, and we're going to do this together. It's so important. I mean, I'm even part of a group on Instagram that texts regularly to drink water. It can be anything.
I need in on that group. Yeah.
Yeah. It can be little daily reminders that are just hey, here's a picture of me drinking my water. Or I took a walk today while I was on a call instead of just sitting on the sofa. Even those little tiny things that we can do with and for each other make a big difference.
Mm-hmm. And I think that, when organizations, when corporations ask me as they do their campaigns, and October's coming, and, what can we do? How can we get more engagement? Well, accountability and bringing along a friend. Women they'll show up because they know somebody else is showing up, right? And so if we know that we're meeting 2 or 3 friends for our annual imaging, right? You're going to show up.
Yeah.
You're going to show up, and then we'll all do it together. And then maybe we go do something fun after that, right? Maybe we all go for pedicures, or maybe we go for walks afterwards. Making ourselves accountable to each other is a way of absolving us of the guilt of doing things for ourselves. Because let's be honest, we do still live with that guilt. Right? Yep. You'll do it for somebody else before you will drive across the country, for someone else, and you won't drive around the block for yourself to get a massage or to get your hair clipped or to do that thing that you've been putting off, right?
Yeah, you're so right. If I have always had to have a workout partner, because I would skip it every single day. But if I know some other woman is going to get up and show up, that I better show up too. And it's that little all right, you're going to feel better when you do it, but needing that community is really important and feels good, actually.
Yeah, it does, especially if you know somebody's counting on you. If you know they're scared and you're going to be their person, you're going to be their rock and their strength, you'll show up. Yeah. And that person can be that for you. So yeah, you can be scared to get your annual imaging. You can be scared to get your colonoscopy. You can be scared to go to a therapist. But guess what? We can be scared together, and we can do it anyway. That's the courage part of it. Courage isn't doing it without fear. It's being afraid and doing it anyway.
Yeah,
Yeah.
totally. I love that. Michelle, I love that we have a comment that someone takes their kids out for ice cream as a reward after doctor's appointments and that we should reward ourselves. Yeah, I think so too. When I first started seeing an oncologist preventatively, I was in my late 20s and I had a newborn and I had no time to myself. And going to New York to go see Dr. Smith was like the only moments I got to myself. And I started making it a thing that I would go and buy myself something every time I went. And
Okay.
it felt like I would come home with like a little package, and sometimes it was like a tank top. You know, it wasn't anything big, but it was still like I spent 30 minutes doing something after the doctor that was like iced coffee, a little shopping, and I felt great. And it doesn't have to be something huge, it can be something really small.
Mm-hmm. It's true. You know, I love tea and I like to make different blends of tea. So maybe you go to the tea shop, right? And you get yourself some different blends that you want to try, or you make it a thing. But we can be creative about it and reinforce those good habits, because I guarantee you that when we don't, our bodies and our minds are trained to sort of perseverate on the negative things, right?
Yeah.
And so if there's something you perceive, and this is the thing with like scanxiety, so anxiety, but about scans for
Right.
people who are still under surveillance and getting imaging, that anxiety is real. And so you have to train your mind and couple that experience with something positive in order to balance it out. Now, I'm no psychologist, but it stands to reason that if every 6 months you got to go do something that you're dreading, you should try to reverse it and make it something that is really that at least balances that experience out for you. Yeah, where you feel like you reward yourself in a way that feels conducive to your health and wellness.
Yeah, well, I love that so much. I want to be respectful of your time. I'm hoping that we can collaborate and cross over in lots of ways. I have an email going out to you and Liz later this week about some of that stuff. And
Love
I'm
it.
just excited to know you and to know the good work that you're doing. And thanks for sharing your insight and your expertise with us.
I hope to do more of this. I love the energy that we have, the conversations that we have every time we get a chance to talk. It's always like, well, wait, what up? And we just like, we explode with ideas and creativity and ways to try to make this all different, because this could all be different. It will all
It will
be
be different.
different someday, soon, if we continue on this path, because that's what does it. It's not the smartest people, it's not the richest people, it's the people who dig in and they're hardworking and their passion takes over and get it done. So we're gonna make this thing different. And I love you for having me on.
Yeah,
And
thanks for making the time. I hope you have a great evening and more soon from you and from me and from us together.
oh yeah, you bet. Have a great evening,
You
okay?
too. Take care, Dr. Mo.
Take care.
Bye bye.